Hi, my name's Linda, and I just passed the Cpne through Excelsior College. I just wanted to post a video about the grid. I know that a lot of people have fear about the grid. I know I certainly did. I had no idea what this grid thing was that everybody was talking about. It sounded like some secret cult thing that I was never going to understand. But alas, I did understand it, and I believe that I had a very good understanding of it after a period of time. Now, take your time understanding it. Focus on your critical elements and learning the study guide first, and learning care plans, of course. But then start focusing on the grid. The grid is your worksheet. That's all it is it's a worksheet, but it's a fabulous worksheet, and whoever invented it is a genius. Okay, so and there's no rhyme or reason to it. You can make your grid whatever you want. So I'm going to show you how I made my grid and explain a little bit about how I used the grid. The very first thing is, well, first let's get to the grid instead of me. Okay. Now this is one I just drew up, and I want to point out that the grid has 12 boxes. So when you get to your Cpne, and hopefully well before that, you're going to practice. So this is going to be on the back of your PCS form. This is where you're going to write all this. Note, when I got to my Cpne test date, the lower half of the grid, of what would have been my grid, or the back side of the paper, now it's bound up here, and I flipped my book over, if you will, my PCS book, and this was all written on. There were the Excelsior College stuff was written here, their address, and it was kind of grayed out, and that freaked me out a little bit because I'm used to using a full blank page, and I was told, actually, that there was a full blank page. But there is not a full blank page. There is 3/4 of a blank page that says notes up at the top, and incidentally, your packet is double-sided, so there's not the back side of each sheet, like when you do it at home and you just print off one sheet and just do it. You have the back side, you have all that room to write notes to yourself. You don't have that in the real PCS packet. But you do have the margins, which I really didn't need to use, because once you learn how to use your grid, you won't really need to have any other space to write in. But like I said, that did freak me out a little bit because I felt like I had less space than I needed. But I didn't. I said, no, I'm going to just go right over that, and I became blind to it. I really didn't see the words under it, the very light words under it. I just used the space anyway and treated it just like my grid, and after my first episode with it, I didn't even see the gobbledygook under it. Okay, so now I write my grid out, and I've got it all put out in a 12 box square boxes. Okay, so you may notice that it seems very busy, but I have a method, and this is, I think, is what's very important, is that you must have your own method, and or a method that works for you. So what I do first is I draw my line over here to make my mini boxes. Okay, 1, 2, 3. I need 3 mini boxes, and then I make 3 linear boxes. Okay, or 3 vertical boxes. Okay, this is going to be my vital sign box. The first box on every grid, every time I practice, anytime, again, methodical. I wanted to make sure that my boxes remained static. They were the same. Okay, so this is where I write my patient's name up here. Write my patient's name and their date of birth, and then I just use it for notes. So this whole box is for notes. The second box is just for notes. I need space for notes to write what I get in report, and what I have perhaps for my cardex that I want to make notes about, although most of that will go into your grid. But anything that you want to write up here, put it in your notes. Okay, you can also use the margin space, although you won't have any margin space on your grid. You're going to have plenty of space, don't worry. Okay, so notes here. Okay, now your next box is your 20-minute box. So this is your 3/4 of a box and 3/4 of a box. This is your 20-minute check box, and then you're going to write your mnemonic here. And then this is also, I like to think of as the fluid box, because you're assigned the area of care of fluid, so you need to have a box for it. Okay, so this is your fluid box, and then this is also where I write my I&O. So if I'm assigned I&O, then, and I box it out like that so that anytime I see a box, I know to myself that I need to do something there. I need to make sure that that box is filled in before I leave the room. Okay, so the way I set up my grid is I read left to right, just like the rest of us do, and that's exactly the way I want my care to flow. So this is what it's going to do. I'm going to walk in, and I'm going to do I've got my notes up here, but I'm going to do my entry, which is my kiwi, knock, wash, introduce, ID the patient, explain to the patient what you're doing there. This is my RN box. This is what the RN may have told me. I want you to tell me if their O2 set is less than 92%. Or anything that I might want to share with the RN, any changes that might happen throughout the PCS, like their blood pressure was sky high or whatever, then I would put that in that box in a little square next to it. So I remember to report off to the RN about that. Okay, and if it was anything immediate, of course, ask to see if you should go and tell her right now. Okay, and the third box is always 20-minute check, regardless if you have IVs or not. If you don't have IVs, fine, but you still have to do hydration, okay? So again, this is your fluid. I like to think of it as my fluid box as well, my 20-minute check. So if nothing else, I'm going to do hydration, and I'm going to document it on my fluid sheet. It does not have to be done within 20 minutes, the hydration, but I do it right then because it's easy to forget. And then, again, the next thing to evaluate your patient, natural progression, is that you'll get their vital signs. So before the vital signs, let's just go back to fluids for a second and for a 20-minute check. If my patient did have an IV, then that is, to me, that's my natural progression of care, is that when I go into a patient's room and they have an IV, I want to check their IV first before I start doing vital signs and all kinds of other things. I want to make sure that that's stable, it's not infiltrated or anything else like that. Okay, so again, this feels natural to me, and it feels like it's the natural way that you should take care of a patient. Vital signs, so then I go right into my vital signs. And the way I've set it up here is I've made box 1 and box 2, just like on the fluid sheet, you'll see that. But my first box is base. So I write in this box what the baseline vital signs were. So especially the blood pressure, because I want to make sure that I don't pump my my sphygmomanometer up beyond 30 points greater than the systolic number. So 140 is what I have written here for a base. So I'm going to only pump it up to 160 so that there's no chance that the CE may think that I went over. But okay, that's going on to a different story. But here is my vital signs, okay? And next to my vital signs, I've written all my baseline vitals here, and of what I was assigned, and regardless whether I was assigned them, you're always assigned vital signs, so you're going to get them every time. But I also write what kind of temperature I need to take. So she asked me to take an oral temperature, so I just wrote a little teeny PO there, a little AP for apical pulse. They're doing work outside, so there's vibration going on out there. And blood pressure, I wrote MAN for manual. It's hard to see there, but it's not really necessary to see that. Okay, and then I'm going to write my vital signs in here as I take them. Okay, and so again, natural progression is after I take the vital signs, and before I give medications, I want to take vital signs, right? So that's why that's there. Before I give my atenolol or any of my blood pressure medications, I want to make sure that I've taken my vital signs or my blood pressure. So I always put meds in this box. Now, you're not always going to be assigned meds, so this box could be blank, and I just leave it that way. Leave it blank. Don't put anything in there. But if you are assigned meds, then this is where it goes, because again, this is the flow, okay? What are you concerned about next? You're concerned about pain, right? So if you're assigned pain, put that in the next box. That will be this, the pain will always be in this box, or comfort in this box if you're assigned it. Otherwise, you can put whatever you want there, and I'll explain again the rationale to what you put in each box in progression. Okay, so this is a standard box. This is a standard box. Standard, a static, I should say, not standard, static. These boxes are always the same. Okay, these boxes down here are always the same. So let's jump down here for a moment. And meds, is always the same. I always leave meds in that box, and again, if I don't get assigned meds, then I just leave that box blank and I can use it for notes later. So let's jump down to the end of the PCS, because this is what this would be, right? Because we started up here, so if we're reading left to right, then this is the end. So I go down to the end and I write scab, 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 okay? Because the reason I write that 3 times is because I am guaranteed to go in and out of that room at least twice, because I've got to go out and get the meds, maybe they want a drink, whatever. And so you want to make sure that you do your mnemonic every time you exit the room, which is the side rails, the call light, the anything else that I can get you, and bed low and locked, okay? And so then you have space to cross that off. And the reason I write 3 of them is because I'm sure to go in and out, and I want to make sure every time I come leave the room that I do this. So when I enter the room, when I come back in and enter the room, I start at the beginning of my grid. When I leave the room, for whatever reason, my eyes need to go immediately to the end of my grid, okay? And when I come back again from getting coffee, I will go back to the beginning of my grid. And then when I leave at the end of my PCS, I'm going to go back to the end of my grid, and always end and begin, okay? All right, so the bottom. And right next to that is mobility. Always, this is again another static thing for me, I always put mobility there. You're always going to be assigned mobility because it's a constant. It is one of the required areas of care. So I always put mobility right there. All right, and the reason for that is that you want to do whatever it is that's required of mobility, whatever you're assigned. Say you need to take them for a walk out to the nurse's station, or you need to transfer them to the chair or whatever. You want to do that last, because if you're assigned respiratory management, or if you're assigned abdominal assessment or any of those things, if you put mobility up here and you flow the way I'm trying to get you to flow, is you're going to end up getting them up and going to sit in the chair, and then the next thing on your list is what? Abdominal assessment. Now what do you have to do? You have to get them back in bed to lay down, right? So always put mobility down here. Mobility is the last thing you do just before you leave, okay? And then, so let's get back up here, and we've given our meds. Let's pretend we were assigned meds, and we were assigned comfort, and we were assigned musculoskeletal, okay? So I put comfort here because I always feel like pain needs to be addressed, pain or comfort needs to be addressed before you do any type of assessment at all, okay? Aside from, well, and you could have actually even assessed it up here with your vital signs, but you can definitely do something about it down here. And this is all going to flow really fairly nicely. Okay, so comfort. So I put my comfort or pain here, all right? And you understand why. And then I put my musculoskeletal, because these are the 3 that I was assigned here. And so then I do whatever I'm required to do there, okay? So look at what I have. I have 2 blank boxes still, okay? So sweet. I have plenty of room on my grid. Okay, I want to go over here real quick to this box now, this mysterious box. This is my care plan box. Now, nobody else has seen, I've never seen anybody use this for a care plan box, but that's something that I chose to do because I don't want to have to flip back through my PCS packet to look at my care plan. So I wanted to put a little mini care plan reminder down here in this box. So what I did was I squared it off into 4 boxes, and I put assessment and intervention. Assessment 1, or care plan 1, and care plan 2. Okay, what was the assessment that I said I was going to do? Assess their ability to ambulate. Okay, and I put a little box right there. Okay, and I just wrote ambulate or assess ambulate. And here I say I had oxygen respiratory therapy or something, and I wanted to check the O2 sat, or that was my assessment. Then I would have written O2 here, checked it, because that's going to remind me. It's just a note to myself. It doesn't mean anything to anybody else but me. And it says I need to check their O2 sat. Okay, and then the interventions are ambulate and rest period. And so I'm just writing little quick notes to myself. So as I go through the grid and through my PCS, I can go back and look. And when I finish my musculoskeletal, then I know that I better go check. Now I'm down here. check and make sure that I have done my assessments. If I haven't, will they be completed when I do my mobility? Okay, so, and then after I finish my mobility, I can go back over here because I still have boxes that are not checked, and then do whatever it is. If there's any boxes that are not checked, then I would complete whatever I was required to do. Okay, there was one other thing that I wanted to tell you, and I just can't. Oh, back up to the name again, and I'm not sure if I mentioned this at the very beginning, but at the very beginning, the very first box, the first two boxes, which I call my note boxes, put your patient's name and their date of birth, but don't use this grid as your patient identification. Use the official Cardex, because that's where the CE wrote down the date of birth and the patient's name, or it's on a sticker or whatever. That's the information you need to go by. Don't use your grid, because you may have transposed a number or a spelling of the word, somebody's name or whatever. So, but use this as your reference. I like to use this for, like, when I forget what the patient's name is because I did or whatever. Then I can say, oh, Betty, or, you know, Mrs. Johnson or whatever. We're going to do this now. Okay? I think that is pretty much the grid. Now, I'm going to hang up another one, and I'm going to just show you what it looks like. Oh, I might be able to hang it up. And this one, same deal, but it's just a little bit different. And that, this is where we start. So this is how we're going to start with our boxes. Okay, then you're going to fill them in. This is much smaller. Okay, and I hope that you can make that bigger on your screen if you need to. And again, it's always the same. The setup is always the same, but your areas of care are different. So here, in this one, I had meds, abdominal assessment, and comfort. Now, in this case, I put comfort after, and I think in reality, I would have put comfort here because, again, I would have checked comfort before doing the abdominal assessment. So I would have flip-flopped those. Okay, and then this one, I was clearly, you can tell what I was assigned. If you just look, you can see that I was only assigned comfort and skin and musculoskeletal on this one. I didn't bother to write in the acronyms. I'll just pretend that they're there. Okay, so on this one, I was assigned 3 different areas of care, which was medications and abdominal and comfort, and this one I was assigned 3 as well. In real life, the likelihood of you being assigned 3 like this, well, I mean, I guess it's pretty possible. I can't even remember what I was assigned, to tell you the truth. I know it wasn't more than 3. So, and then you go back and well, and what you do is you pass. So, I hope that helps to demystify the grid a little bit, and take care and good luck. Past that thing.